Hello, you're listening to a public service announcement on the use of marijuana during pregnancies and the side effects. The use of inhalants like cigarettes, marijuana, or blunts can affect both the mother and newborn health during pregnancy. During 2008 and 2015, cigarette sales increased by 51%. Illegal sales of marijuana, depending on the laws of the respective states, also increased during this time. Marijuana is one of the most commonly inhaled illegal substance used during pregnancy in the U.S. Research data collected by the U.S. National Survey on Drug Use and Health analyzed cigarette and blunt used by women of reproductive age between the ages of 18 and 44. This research showed that since 2013, the use of blunt is increasing in pregnancy, even in the second and third trimester. The 2016 National Survey on Drug Use and Health reported that 4.9% of pregnant women use marijuana during their pregnancy. Women are drawn to smoking blunts for various reasons. Some include the perceived lower risk of blunts compared to cigarette smoking. Blunts are cheaper than cigarettes, which in most states is heavily taxed. There are many flavors and senses that make blunt smoking more appealing. However, the toxins in blunts and cigarettes are very toxic to the unborn fetus. Role of organizations, local, state, and federal governments in assisting with helping with this problem. At the federal level, marijuana is still illegal. Cannabis and marijuana are used interchangeably, but they are not exactly the same. The term cannabis represents the byproducts of several substances that come from the cannabis sativa plant. There are in total 540 such substances that come from the cannabis plant. Marijuana comes from the cannabis sativa plant that contains the chemical THC. It is that substance that alters the person's mental state and causes problems to the newborn child when used during pregnancy. In some states, it is only legal for medicinal use, like to aid a woman in morning sickness. However, the Surgeon General, Jerome Adams, cautioned that all levels of government need to provide information that will be disseminated to clinicians about the risk of marijuana use for medicinal purposes. Continued research in this area is needed. In states like North Carolina, where marijuana is illegal, women who have substance abuse issues like marijuana during pregnancies are not criminalized. Research has shown that criminalizing women who have substance abuse problems during pregnancy will only alienate them from seeking prenatal care. Instead, if the baby tests positive for a substance used in the drug screening after birth, a referral will be made to the local Child Protective Service, along with a follow-up to make sure the baby is safe. This allows the woman to get help during the prenatal stages and feel that she will not be reported to CPS or prosecuted if she tries to seek help for herself and her unborn child. One such program is the Walter B. Jones Woodside Treatment Center. High-risk prenatal program is a local government program in North Carolina. It is an inpatient program that helps women who are in their first, second, and third trimester. They obtain treatment for substance abuse during their pregnancy. Women are commonly referred to from the surrounding health departments or social service offices, but walk-ins are welcomed for an assessment. Risk risk marijuana poses to mother and baby. Polysubstance use by pregnant women is common. Those who use opioids tend to use alcohol and illicit drugs like cannabis. There is research evidence that the poor long term health outcomes of newborns who are diagnosed with fetal alcohol spectrum disorder. The substance THC found in marijuana crosses the placenta during breastfeeding, which can affect babies' development. Health organizations like the Substance Abuse and Mental Services Health Administration provide information on the risk of marijuana use for everyone. However, in the case of fetuses that are exposed to marijuana during fetal development, this can lead to premature birth, which increases the risk of the baby having a low birth rate and poor ADGAR scores, cognitive delays or hyperactivity as the child develops, and increased risk of stillbirth deaths. What can individuals and family members do? Women who are attempting to get pregnant or become pregnant should stop smoking. Seek substance abuse help during pregnancy. You will not be criminalized. Instead, you will get help for the unborn child and yourself. Talk to your doctor, obstetrician, and nurse and get information about prenatal care. In states where marijuana is legal, like in Colorado, the Public Health Department can provide expectant mothers and their family members with educational material about the use of marijuana during pregnancies and during lactation. Health providers' role in the treatment and interventions of marijuana use during pregnancy. Women should be screened during prenatal visits for substance abuse. Unmarried females are likely to use marijuana during pregnancy. Women who have a diagnosis of major depression episodes were more likely to use marijuana. Social economic health, education, along with family dynamics can affect the woman's decision to use marijuana during pregnancy. Prescriptions should be used with caution when prescribing marijuana for medicinal uses. In fact, the American College of Obstetricians and Gynecologists give a precautionary warning to those physicians practicing in those states where marijuana is legal. With some states legalizing marijuana, this has caused a false perception that marijuana is safe, with little or no consequences to the fetus or child development. However, this is a false narrative, as research has proven that TSH does affect birth outcomes and neurological development. Overall, the use of marijuana increases the risk of one becoming dependent on other substances. Furthermore, the long-term negative effects of drugs is costly to our society. Thank you for listening to this public service announcement.